So today we are going to be doing brain development and the impact of trauma. It's going to be a little bit more dense than last week, but I did try to, with Corky's help, make it as involved as possible. And the idea is basically to give you guys a framework so that you can take pieces of it and work with your staffs to give them a framework on brain development. It's not so that they become neuroscientists or anything like that. I tried to stick to the basics so that you can kind of understand what's going on. So when a child is acting in a certain way, they have a better understanding of what's actually going on up here. And the impact of trauma is not referencing like head traumas. My mom is a nurse, and when she was reading through this, she was like, wait, you don't talk about head traumas in there? And I was like, no. This is about external traumas impacting the child and their brain development, just to be clear. Okay. So our objectives today are understanding the critical importance of early brain development and architecture of the brain development, understanding basic mechanisms that determine early brain development and the ideal time frame or windows for specific learning, how abuse, neglect, trauma, toxic stress, as well as prenatal exposure to drugs, alcohol affect brain development and impact the overall health of infants and toddlers, and selecting the most useful brain development concepts to share with your early childhood staff and parents or caregivers and be able to express them in simple language. So what I'd like everybody to do while we're going through this is just to make notes on your PowerPoints, flagging things that you find important, because we're going to do an activity at the end where we're going to talk about what you guys found was most prudent and what your teachers would need to know and how they would be able to explain that in simple terms to parents or caregivers. So get those pens out and keep writing. So this is a quote that I came across early in my research on brain development, and I just feel like it's frankly applicable to this entire training, but particularly to this one. Conception to 3 is the most critical time in human development. Anything is possible during this time. And as people that work in childcare settings, you see this every day where you get a child that comes in, it may not be speaking, but then they're in an engaging program with engaging caregivers, and 3 months later they're speaking in full sentences or whatever. I mean, we see this luckily almost on a daily basis. I would say the rest of the world probably doesn't, but I think it's just really important to remember this and to drive it home with pretty much everybody that 0 to 3 is just the most critical time in human development. So the basics on the brain. Like I said, I'm trying to keep this as simple as possible. I'm not a medical professional. I am just trying to give it to you guys from the perspective of a social worker and breaking it down in a simple way. And again, it's not so much that you know specifically what neurons are or the central nervous system. It's to give you a basic framework so that your teachers have a basic framework. And it's more the themes that you're going to see throughout this training in regards to this whole system rather than specifically knowing like what's an axon. So the central nervous system is made up of the brains, neurons, spinal cord. It's responsible for sending, receiving, interpreting information from all parts of the body. So it's critical. You really can't exist without a central nervous system. Now, of course, Patricia's a nurse, so she might be able to tell you different, but my understanding is that you have to have that in order to function.
But this is good.
Oh, great.
Yeah, I will say, though, that it's not the brain, the other system that's not fully developed at birth is the immune system.
Ah, yes,
So,
okay.
And so there is some conversation about if trauma does have impact on the immune system.
And it does, and
it
we're going to
does.
get
So-
to that,
so I think
yes.
that we just need to remember that.
Right.
That's why we don't give babies honey.
Right.
And why we encourage breastfeeding. Because
Yes.
the immune, blah, blah, blah.
Exactly.
So it's not the only one, but it's the big one.
Right, so it's the only organ that's not developed fully at birth. And of course, this is also keeping in mind with premature babies, you often get, underdeveloped lungs and things like that. But on every single baby that's born, the organ is not fully developed at birth, which means it has a really great period of growth after, and the reason primarily, my understanding for it, is the brain grows from engagement. It's activity driven, and although I'm sure in the womb it's very engaging and exciting, it's more exciting out in the world where there are new sights and new sounds on a daily basis. So the neurons are the cells in the brain that process and transmit the information through chemical and electrical signals. Synapses allow the neurons to pass the information around along the axons. And for those who, like myself, have to read this like 500 times and you're still like, what is going on with that? We broke it into a different way. So think of it as, and I give total credit to Corky on this because I spent many, many hours trying to figure out a really good analogy to explain that, and Corky came up with this. The central nervous system is the emergency dispatch. Neurons are the first responders, so the message goes out to the neurons. Synapses are the local roads that the first responders have to take going to where they're going. The axons are the highways, which you can't get to without the synapses, and then they're going to the other first responders. Again, this is a very basic description, and it's, for our purposes, it's as accurate as you need it to be. Again, having my mom as a nurse, she was like, well, actually the signals go this way and that way. But for you guys to get it, neurons, jumps over the synapses, down the axons to another neuron. And without that, you don't get the transmission of whatever the central nervous system is telling you. They don't go otherwise. So has anybody ever heard this term before? Neurons that fire together, wire together? What is your understanding, not to put you on the spot, what is your understanding of it? Or if anybody else wants to chime in.
I saw this really awesome movie that was kind of like touchy-feely, but it was called What the Bleep Do We Know? And it was
Oh, yeah.
about
Yep.
neurotransmitters, and it was basically like, if you have repetitive thought patterns, then that starts to like make a connection where like the way that you're, like the way I describe it, like the way you're thinking about something, you get into these ruts where it's,
Yes.
you have to, and you have to try hard to make a new one, like a new,
Yes.
like a more positive way of thinking, but
Yes.
you can get there, you just have to like adjust it repetitive, and then eventually that will start syncing up.
Exactly. That is a great description of it. That is exactly what it is you get your neurons firing off these signals, and the more they fire, then they start to wire themselves together into a more permanent fashion. If you don't use it, which we're going to get to in a second, you end up losing that connection. Or you can also alter the thought patterns by creating new neural pathways, is what they call them. So for each experience we encounter, whether feeling a thought or a sensation, especially those we're not aware of, neurons are firing off messages to one another. Repeated experiences make it easier for the neurons to fire in response to the experience and strengthen the connection, also making it more difficult to unwire or rewire them to respond differently. So this is a really positive thing in the sense of, there are so many things that you do repetitively and it becomes easier because you're firing and your neurons are wiring together and becoming more solid. But to change a behavior, it makes it harder. Luckily for little ones, their brains are creating all these neural pathways all the time, particularly during 0 to 3. And so those neural pathways are much easier to shift. So, if a child is exposed to violence and their neural pathway is creating a response to that, and then they're removed from that home and put into a peaceful, supportive environment, you can help that child to redirect those neural pathways. Adults, much harder, because your brain starts to solidify, and that's why you get kids that are in therapy for, a month to 6 months, whereas you get adults who are in therapy for like 15 years and may not necessarily see any changes because, again, 0 to 3 is the most critical time. The baby's brains are like little fireworks shows, and they're just constantly going off, and they're open and ready for change, whereas adult minds, we're a little more stuck in our ways. The things have really solidified by the time we're adults, although you can totally change it, like the movie probably said, I hope. So the synapses, which are critical to get the message from one neuron to the other neuron, that's what it looks like at birth. The from your guys' perspective, the left picture. So there are very few. And then the baby gets out and starts being exposed to the world and engagement. And that's what it looks like at 2 years old. So their brains are really working hard to get all these pathways going so that they can process the experiences that they're having. Because everything to a newborn is brand new. Like your face is new, the environment is new. They see new things every day and every minute. And this is their brain trying to process that information and put it into an efficient, organized fashion so that they can process it and keep it in a way that's going to be helpful for them. However, growth like this does not continue forever. So there's the 2-year-old again, and then you can see with the 6-year-old things slow down a lot. And again, that's because 0 to 3 is a really critical time for brain growth. And once you get over 3, things start to solidify a little bit more. It's harder to change those neural pathways, which is also when you see kids that have been in abusive or neglectful situations, and you see a behavior of a 6-year-old, it's often more extreme, harder to change the behavior than, say, a 2-year-old. So this picture here, with the 2-year-old, you've got all these synapses going, and then the 6-year-olds, there's less. It's not only because they're creating less neural pathways, it's also because they're pruning ones that aren't used. So the brain ascribes to this philosophy of use it or lose it. You know, a baby will have an experience, they'll create a pathway, and then if they don't ever use that pathway again, their brain's gonna be like, nope, we don't have space for this, we need to cut it back. And that's why you end up with less synapses as the kids get older. So again, for a 0 to 3-year-old, it's really important for certain pathways that you really want to encourage, such as like language development, visual stuff, emotional control. You want to keep reinforcing those, particularly at 0 to 3, so that they're really solid and they're not going to be pruned back. So the brain is constantly wiring and rewiring, even as adults. Like you had said, you know, you might be in this rut, and then you start doing cognitive behavioral therapy or whatever you're doing, and you can change it. Again, it just becomes harder as you become older. So after the first birthday, pruning occurs more quickly. The greatest increase in pruning is between 1 and 3 or 4 years, so not really sure. It really depends on the child. But again, I know I keep repeating myself, but this is the 0 to 3 is the most important time because it's when you see this explosive growth and then things that aren't being used start getting cut back. By age 10, a child has 500 trillion synapses, which is the same as an adult. So the growth has slowed considerably after that. Early experiences, both positive and negative, have dramatic effects on formations of synapses. Can anybody think why that would be?
Because the brain is wired for growth, and so it's very open.
Right.
All types of experiences.
Exactly. And if you're having positive experiences, you're going to be creating these neural pathways that are encouraging that. And if you're having negative experiences, you're also going to be creating all these neural pathways, but they're not going to be as effective for the child. So also with this too, something that I've come across a number of times is with language development in kids. So have you ever seen kids that are raised in multicultural homes or bilingual homes, and they seem to pick up languages like that, like no problems at all? They just bop back and forth between the languages. That's because they're creating all these synapses that allow them to absorb both languages, process them, organize them, and use them in an effective way. But then if the child moves out of that home or is not exposed to all the different languages, that's when you start, the synapses start getting pruned back and they lose their ability to speak in whatever other languages there are. And interestingly enough, for a long time, people in the medical field, and I don't know about the developmental field, but they felt like exposing kids to multiple languages or raising them in bilingual homes was really hard for them. It delayed them. It wasn't something they should do. You should only speak to them in one language. And now they know that that's totally not true at all. You may see some delays or lags in certain areas, but in the long run, the kids are totally fine. And because their little brains are firing all these messages off and creating all these neural pathways to allow them to use both of those languages in an effective way. That helps them. So again, I know I keep repeating this, but the most important period is 1 to 3 year olds for developing self-regulation, problem solving, social, emotional, language, and communication behaviors. You know, I think people sometimes will think, oh, they're little babies. What do they really know about, you know, social, emotional behaviors or controlling themselves? And as you guys, because most of you work with the 0 to 3 population or 0 to 5, you know this is one of the big things that they try to do in classrooms is they try to help these kids learn these skills, because then you're setting up the foundation for them to be able to use them later in life. So you're setting up those neural pathways, solidifying them, making them really strong so that they can't be unwired later. And you've got then a 6-year-old who can do some self-regulation. So the why of wiring. So I know last time with the early childhood mental health training last week, we talked a lot about, well, I felt like we talked a lot about sort of developing a child's social emotional foundation, the whole building thing. This is basically what a child is doing when their brain is being wired. So they're being exposed to activities, their brain is wiring, and they're creating this entire foundation that's going to last for their entire lifetime. And what happens when they aren't creating these neural pathways or this wiring is then you start seeing behavioral, emotional problems, and it's harder to change it as the child gets older. So the quality of experiences and relationships in the first 3 years has a deep and lasting impact on the brains. Again, you see this all the time in classrooms. A kid comes in maybe from a less stimulating environment. They kind of have a flat affect or they're not engaging. And then they're put into a classroom where there are all these kids and activities and teachers, and they start blossoming. And that's because their brain is being exposed to all these other new activities, and they're creating all the pathways for it. So I want to talk a little bit about serve and return. Has anybody ever heard of serve and return? So when I first came across this, I was like, serve and return? I don't even know what that is. I always called it the flirting dance. And then Allison, when we were talking about it, she calls it something totally different. It's basically when you're holding a child and they smile at you, you smile back. And it's this back and forth and engagement. Does anybody else call it anything else? Or y'all know that term? You guys are way more advanced than I am on that one then. What is it?
Just like reciprocal.
Yeah.
Reciprocal
Yep. Exactly. So this is really important for children to develop healthy brain architecture. The back and forth and the social engagement. When a child's left in a crib by themselves all the time because the parent is off doing I don't know what, it can really be devastating for the baby's brain architecture. They're missing those important stimulating moments that allows them to wire their brains for social interaction. And, you know, at a 6-month-old, you know, they may come into a classroom or come into a foster home and be really flat, not engaging. And it's because they haven't developed all those neural pathways to help them to engage in that way. And also to know, if I do this, somebody's going to do it back to me. And there's a benefit to it. So I threw in a little bit more science. Again, a lot of this is repeating the messages that you guys have already seen. It's just, you know, early relationships have permanent effects on brain development, health, and later mental health. Social, emotional health, and physical health are inseparable. And the idea with that is, you know, if a child is anxious all the time or depressed or fearful all the time, that's going to affect their immune system, and it's going to make them have all sorts of health issues. And there are all sorts of studies that show that kids who experience trauma, neglect, abuse in childhood have chronic medical issues as adults, and they didn't follow them from beginning to end, but it was a retrospective studies, and basically what they felt was that it was the abuse and neglect and the toxic stress that was affecting the immune systems, causing these long-term issues in the health of the adults. Responsive caregivers, supposed to be can, not scan, mediate the effects of some chronic health issues such as prematurity, prenatal drug exposure, poverty. You see this all the time when a child is removed from a neglectful or abusive home and put into a really receptive, responsive foster home, and kids start rebounding, they're blossoming. And that's not just a coincidence, it's because they're being stimulated, they're engaging, and with a caregiver who has now become their guide in life and helps them to develop their emotional foundation, social emotional foundation. Social emotional development is strongly linked to success in school, and we see this all the time, either in preschool settings or in elementary school settings. You know, if the foundation isn't there in the beginning, it makes it much harder for the child to then concentrate or have impulse control when they're in preschool or they're in elementary school. And unfortunately, that's usually the time when kids are sort of flagged as having issues and needing some kind of intervention services, because that's when it starts to disrupt our lives. But it's actually services needed to be put in place earlier so that you can affect change more easily for the child. An intervention can be effective. Children tend to rebound pretty quickly with appropriate services. Adults, we can be in therapy forever and not necessarily see any changes. But, you know, I've also seen adults make changes. You see it all the time with adults with substance abuse or some mental health issues. You know, you get effective treatment and you can change those pathways that are inside the head, inside the brain. So windows of learning, this is the idea that, it's not an idea, I guess it's researched, but that in development, there are certain times that kids are more open to learning certain things. So you can't teach a 6-month-old or a 3-month-old to walk. That's just not, their window for walking is not open at that point. And you know, you can teach a 6-year-old how to feed themselves if for some reason they don't have that skill, but it's going to be much harder for them because you've missed the window. Usually kids start to feed themselves around, you know, a year or a little bit before. So some windows are really important to not miss. However, it is important to remember the windows don't close all the way. It just, again, becomes harder the older the child is. So what can they do when? So with visual development, I've totally lost you guys in my notes. So in terms of a window, people don't think windows, like they think vision is just something you're born with, just progresses, you're fine, maybe you need glasses, maybe you don't. And that's not actually the case. There was one study that I came across that said that children born with cross eyes or lazy eyes will fail to develop full acuity and depth perception if the problem's not corrected promptly, which was surprising to me when I came across it, because again, I just thought, well, the baby will just, you know, develop as they go along. But it was one of those windows that this is a skill that the baby learns early on, depth perception, for example, and then it starts to close the older the child gets. So a child's in a neglected home, they don't get to their doctor's appointments, they have their lazy eye, and then it gets corrected at 6. And no matter what skills the child develops, they're not going to have the full depth perception that a child that had a surgery at, let's say, 6 months would have. And the good thing is, you know, kids can learn all sorts of coping skills too to make up for whatever might be lacking if they've missed part of the window. And the other thing to remember too is these are all just estimates. I mean, they're kind of broad ranges because scientists don't really know what the specific timelines are. They've done a lot more research on animals. So they, for instance, like they know that monkeys need consistent social contact in the first 6 months or they end up severely emotionally disturbed. But that's something that they're not going to be able to do with kids for obvious reasons. So math and logic skills, birth to 4, which again, I don't know how many preschools are thinking, oh, I need to be teaching this child math, but that's a left brain thing, which we'll get to in a second, but it's an important skill to start encouraging. So language skills, we talked about this a little bit before. Engagement is really important around language, and when the child engages with an adult or a caregiver around language, sky's the limit. They can learn a bazillion different languages and be fluent forever as long as they're getting that engagement and the pathways are being developed. And another really interesting thing, and I'm sorry I'm giving you all these like little random factoids, but have you ever noticed if a child learns a language before the age of 10, as an adult, they can speak that language without an accent. But if they're over 10 to 12, they have an accent. So you'll see people that are immigrating, and as adults, they always have their accent. No matter how, they could have been in a country for 30 years, and they will still have an accent. And it has to do with the neural pathways hardening up and solidifying. And for kids under 10, they're creating these neural pathways to absorb the language and learn the language without the accent. And older than that, your brain pathways, you can still learn the language, but you're always going to have an accent. It's just kind of a random little factoid. So now when you guys meet people that speak multiple languages, you can find out. Ask them when they learn the language. Oh, really? Have you met families that, really?
But they can speak perfect English and Spanish, and the English being way better.
Interesting.
So I think it also is the ability of people hearing,
That too, yes.
and being able to pronounce. There's some sounds that in some language are harder than others.
Yes,
I think,
definitely.
like, if you look at Spanish or French, you use a lot of your throat to say some sounds. And if you're not accustomed to do them, those may be harder
Right.
language. But
Right.
language that doesn't use or use similar parts of your mouth to speak are easier.
That would make sense because then you can dropping the accent or, it's easier to flow from one language to the other. That's great. I've not run across that, but that's fantastic. And I will now pay attention to that one.
Also, if you were exposed as an early child, when you were exposed to the English language with an accent, and
Yes.
earlier age, you acquire that accent. Because from my personal experiences, Tibetans were never exposed to English language. When they come to America, the only English that they learn is American English. So they do not have
Yes.
an accent.
Yes.
Over the adults. So they speak any sort, if you're talking about tomato, they would say tomato in a very American accent. Because I grew up saying tomato,
Uh-huh.
so I have that little weird British
Yep.
and English mixed together. So I have a harder time with a lot of American accents. Because I'm exposed to English with the kind of Indian accent, British accent,
Right.
local accents.
Right.
So I'm have my own accent. I'm
Yes.
not a typical Tibetan accent, but I'm my own accent. So
Right. And I think you're really right. It depends on what other languages you're being exposed to. American English, if you're exposed to that, you're going to be able to do, not do the American accent, but you're able to speak in American English without a perceived accent versus if you... Well, I think that's true though, because, British English and American English sound different to English speakers and to...
Even within English.
Yeah.
Even regionally.
Yep, exactly. So emotional control, we talked about this a fair amount the last time, that, this is when you start seeing cracks in the foundation of the child's social emotional house by age 2. So, and part of that is just age appropriate also. They're testing all the limits and boundaries. But this is a skill that they should be working on, and having some amount of control. I say that very loosely because I've met some 2-year-olds who have no emotional control at all. Yes, exactly. Exactly. Yes. But also an example of this sort of in the emotional realm is I have a friend who was neglected pretty severely from birth to 2, and then he was put in foster care until he was 4, and he was adopted at 4 and given everything you could possibly imagine, 2 loving parents, everything that he could possibly need. And even as an adult, he has anxiety, he has issues around control, he has issues around abandonment, being left alone, being left behind. And you would think, he's now 34, so 30 years of sort of corrective experiences, and yet those basic experiences that happened to him and his brain when he was 0 to 2 years old, and then whatever he experienced in foster care, have stuck with him, and because his wires have solidified, and it's much harder the older the child gets to shift those. And he's been to years of therapy and all sorts of stuff, and he's totally, what I would call as a functional adult. Like, he's doing everything he needs to be doing, but it's sort of these underlying, more subtle things that we are really good at hiding a lot of the time are still there. And social attachment, the story of my friend, the same thing. By 2, it's really a critical window that kids need to be exposed to attachment, positive attachment. And next week we're actually going to be talking about attachment and trauma, so we'll get into that for like 2 hours. And then 3 to 10 is music. And by age 5, it's motor development. And again, these are just windows. They vary for different kids, and they're not even sure how accurate these timelines are, but it's just sort of general things to keep in mind. Yeah. I was surprised by that too. And I don't know if they were talking, because what the article that I was reading didn't extrapolate on it, but I don't know if they're talking about sort of being really proficient in music, as in like pianists and things like that. Love music. Yep. Yeah. I was surprised by that too. I don't know. And so I'm just assuming that they're talking about something more formal, such as instruments. Because you don't see many 2-year-olds on a violin. Sometimes you do, but you often hear about prodigies between 3 and 5. Yeah. So we're going to shift directions just a little bit onto the impact of prenatal drug exposure. In all my consultations that I do at the child care centers, this is like the number one thing that teachers want to know about. They always want to know about what are the effects of having prenatal drug exposure. So it's important to remember that the brain development begins 3 weeks after conception. So parents that are telling you, oh, it's not that big of a deal if I'm using during pregnancy, they're wrong. It's totally starting to affect the child as early as 3 weeks. And oddly enough, too, using in the first trimester and the third trimester are far worse for the baby, something about those parts of the brain being developed, than in the second trimester. So I'm always like, if you're going to use in the second trimester, and abstain in the first and the third, and see how that works out. So the studies that have been done on prenatal drug exposure are mixed, because a lot of researchers basically say they can't tell what's prenatal drug exposure and what's environment. But these are some of the general, this is the general consensus on these are the effects of prenatal drug exposure. So tobacco, you get central nervous system stress, low birth weight, greater muscle tension, which actually seems to be across the board for drugs in general. You get babies that are really tight up like that, or when you hold them up, and usually kids bounce like this. If you're putting them in a standing position, they just lock their legs. More difficulty self-soothing, negative affect, lower IQ throughout childhood. And again, I take all of this with a grain of salt because each child is so very individual. And I have seen kids that have been exposed to all sorts of crazy drugs and are totally fine. And then I've seen other kids that their parent reports, oh, I only did this for a couple of weeks and they've got all sorts of issues. So down at the bottom, the effects may be subtle, transient, or non-existent. It really depends on the child.
So these are all prenatal things for the mother. Have you come across any things for the, like, how it affects sperm and, you know?
Say that.
These are things during the prenatal, you know, growth and development.
Yep. And after birth.
And after
These are
birth,
postnatal.
right. But how about the effects on the father, like for how it affects sperm?
For the sperm.
Yeah.
I don't know. That's a very interesting, I could look it up for you if you want to put it on the parking lot. I don't know. I mean, I've heard that, you know, marijuana use decreases sperm count, but then I also know people who use marijuana and have 4 kids. So, you know, I think,
Different too, men are constantly.
yeah, flushing their system.
So
Yes.
it's probably the more acute, like what were they
Yeah.
doing to their body right before?
Right.
conception or,
Yes. Mm-hmm.
like,
Yeah.
forever.
Yeah, and you know, I've heard in my previous life as a, and we may have to edit this, but in my previous life as a DCF worker, I've had moms say they'll have a positive drug test and say, oh, you know, I was I'm trying to think of how to say this in an appropriate way. I was giving oral sex to my boyfriend, and he used, and I swallowed, and that's how I have this positive test. And I'm like, yeah, I don't think so. But that's a really great, people can be very creative about it. But, you know, I've also never done research on it, so maybe it's a possibility. But in general, this is all talking about when the mother is using while she's pregnant and the impacts either in utero or postnatal. So marijuana exposure, you know, again, I've seen a lot of people say, well, it's not that big of a deal. I'm just smoking a joint here or there. It does have impacts, and again, it depends on how much the mother is using. But it tends to be a little bit more mild because I'm sure people would object to this. It seemed to me it's a more mild drug as compared to heroin. But you still do have impairments. But the thing with marijuana is all the effects tend to be gone by 6 months to a year, whereas some of the other drugs you see longer. So opiates, like heroin, tend to have the most severe postnatal withdrawals. If you see a baby that's going through withdrawals, it's really a painful and long process. The child is constantly in discomfort, and you're talking, they can have withdrawals 6 months, 9 months, and they often have to be on some kind of substitute drug to moderate the withdrawals.
Opiate withdrawal for adults looks the most dramatic
Yes.
as opposed to other drug withdrawal. And
Yes.
opiate withdrawal in adults is not fatal, unlike alcohol or central nervous system depressants like antidepressants, like anxiolytics like Valium and that kind of thing, because they decrease the seizure threshold. Where opiate exposure for adults does not, it doesn't do anything to the seizure threshold. So even though it looks like a much more severe abuse of severe withdrawal for adults, it's not like threatening as opposed to some of the other kinds of withdrawal. So it makes sense that in infants it would also look very severe.
Right.
Because it's really looks awful.
Right.
in adults.
And a lot of parents who have had opiate addictions in the past, they will, in going through treatment, they'll get onto methadone or Sububox or Subutex. Methadone, in my experience, has almost the same withdrawal effects on newborns as heroin does. Yes, exactly. It's basically, in my understanding, sort of basically clean heroin that they're using. The Subutex is what the parents will use while they're pregnant, and the withdrawals from that seem to be a lot less. which is interesting. It seems to be the general philosophy that clinics are trying to change over from methadone to Subutex or Subuvox, but I'm sure issues around insurance and such. So with cocaine exposure, there have been tons of studies on infants with cocaine exposure because of the crack epidemic in the 1980s, and everybody was very concerned about all these crack babies and what was going to happen to them. Overall, so you can see in comparison, these impacts are, there are a lot of them, but they're sort of mild, whereas with the cocaine exposure, it's a lot bigger and sort of long-term effects, but that's because there have been a lot bigger and long-term studies on these kids. So there have been less studies on opiates, less studies on marijuana exposure, less studies on methamphetamines. Overall, my sense from the research seems to be that if kids are put into a supportive, engaging, stimulating environment, they're fine. The long-term effects seem to be mitigated by the attentive caregiver. But you also can see this. And again, each child is different. There was a child that I worked with who was the youngest of 5 siblings, and he was placed with a foster mom shortly after birth. All the kids had been exposed to cocaine or crack, and the caregiver ended up becoming his legal guardian, whereas the 4 older siblings all went back to the mom. And then the caregiver came back when this kid was 15 because she wanted to do an adoption. And he was a straight A student, the captain of his basketball team, totally no behavioral issues, fantastic kid all around. And his siblings, meanwhile, who had gone back to the mom, they were in and out of jail. None of them had completed high school. They had a lot of behavioral issues. But again, it's a question of how much of that was the environment and how much of it was the drug exposure, because the youngest child, was basically removed from all that, whereas the 4 older ones continued to live with a substance abusing parent, continued to live in a really violent world, whereas the other child was completely removed. So again, it's sort of, oh, yeah.
So I just wanted to ask because I didn't see anything specifically about visual acuity in terms of related to this, but I worked with a child who, was 18, but he, was assessed at a developmental level of, he was 9 months at 18 years old. And he had major prenatal drug exposure, and his scanning of the room was always his eyes were moving really, really fast.
Oh, the jittery back thing, yeah.
And I saw that with a couple of kiddos I worked with who had prenatal drug exposure. I don't know if it was the same kind of drug exposure, but it was that, almost like their eyes couldn't really stay still, and they were scanning really quickly all the time.
So if,
I just kind of wondered about that.
I'm not sure, because obviously I haven't met this kid, there is a medical condition where the eyeballs kind of bop back and forth continually. And I've seen that in people that have not had prenatal drug exposure. If he is having, right, and if he is having visual issues, it's most likely actually related to alcohol exposure, would be my guess, which we'll get to in a second, because that's just, so methamphetamines, it's kind of a newer drug. It's not new. It's been around for 10 years. Yeah.
I was just wondering, when you have families that a child has been exposed to multiple drugs, does that mean all of these effects are accumulated and will take longer to
That's actually a fantastic point that I forgot to mention. That's the other issue with doing studies on kids that have been exposed to drugs because of the polysubstance issue. And they don't know, is this heroin that's causing this? Is this the cocaine that's causing this? And again, this is just my understanding, it's not a cumulative effect. They were exposed to opiates and crack, so we've got the opiate stuff and we've got all the crack stuff. It's, let's pick the lower birth weight and then the delay in general cognitive functioning and then attention problem. It just varies depending on the child, but it exposes them to both of those symptoms.
Makes sense, because certainly with cocaine, it's really common to see a care without alcohol.
Yeah, yep, exactly. So again, methamphetamines, there's only been one large study that was done on infants exposed to methamphetamines because there just hasn't been the attention thus far, or the long-term studies. Meth, I think, has been around for, I don't know how long, maybe 10 years, and they haven't done the extensive studies because it takes a while for everybody to get aware of meth as a problem, and then, following the kids out from there. In my work, I've seen a lot of kids that have been exposed to methamphetamines have higher rates of ADHD, sensory integration issues, but they tend to, like most of the other drugs, outgrow these behaviors or develop coping skills to help them with them. So fetal alcohol syndrome. Does anybody know what's different about alcohol exposure versus all those other drugs that we talked about? Did I write it on here? Oh, yeah. Yeah, it's the only truly permanent damaging drug. And, it is the leading cause of mental retardation in kids. And we're going to get to some brain scans in a second. It is a very scary drug for a parent to be using. And, parents will say, oh, well, I just had a couple of drinks. And there's no like, oh, well, if you have 2 drinks, you're fine. Or if you have 50 drinks, you're fine. They don't know because it affects each mother differently. It affects each baby differently. So the advice always is just don't drink at all. Why risk it? Now, most of these cases, you're talking about parents who drank heavily and consistently throughout the pregnancy. You get facial and cranial abnormalities, which we'll get to in a second. But I put the description of the basic abnormalities down at the bottom. Hyperactivity, poor attention, low birth weight, small throughout childhood, weakness on the core and midline. So anything that runs down the center is going to be affected. So their coordination, their walking, vision, brain, you'll have to correct me on this, what's the connector between the two sides of the brain, the corpus callosum? That tends to be very small or non-existent, which is obviously a big problem if the two sides of your brain are not being connected. Vision impairment, ADHD, lack of organization, poor judgment, inability to learn from previous experiences. I've heard some social workers talk about kids with fetal alcohol syndrome as the kids with no conscience. And that to me is kind of a misnomer. It basically, they bite a kid and you say, don't bite that child again because it hurts them. And then you turn around and they've bitten the kid again because they're not able to process the cause and effect. I bite this child, it hurts them, I shouldn't do it again. They're missing that link because the brain is permanently damaged by the alcohol. So these are, and I know we're kind of getting a little bit away from the brain development, but we'll come back to it in a second. These are some of the basic features, physical features that are associated with fetal alcohol syndrome. But this over here, I put this in here because, people will say, oh, they've got the epicanthal folds. They definitely were exposed to drugs or alcohol. All these kids, none of them were exposed to alcohol, and yet they all have the epicanthal fold, which is like an extra little fold in their eyelid right there. So it's always important to remember and to remind teachers, just because this kid might look like they have certain features doesn't necessarily, you can't jump to the conclusion, oh, I definitely know they were exposed to alcohol and that explains why they're whatever. So who wants to guess which of these kids has fetal alcohol syndrome? 5, 6, 4, 7, 8, not 8. So the ones that have fetal alcohol syndrome are 3, 4, 5, 6, and 7. This child has Down syndrome. That's my nephew, who just happens to look like he's got fetal alcohol syndrome when he smiles because he loses his upper lip. And that's just a child who I was putting in there just so, because his facial features, he's a little flatter right here, and that's one of the symptoms, physical symptoms of fetal alcohol syndrome. But he wasn't exposed to alcohol. So it's just really important to remember a child may look in a certain way, and my brother and sister-in-law have gotten so tired about my jokes about how my nephew looks like he's got fetal alcohol syndrome, and he doesn't, and that's just important to remember. Again, not jumping to conclusions about, well, I think this child looks like they've had this exposure, therefore I'm going to treat them that way. And number 5 is the very classic fetal alcohol syndrome. The big eyes that are kind of a little droopy, really flat underneath the nose, small upper lip, lower ears, and flat across the nasal bridge, because again, it's all midline.
It's really interesting that the child at number 5 looks also very much like the children that I work with Fragile X syndrome.
That's interesting. Yes. Yes.
There's something very similar about it.
And I didn't read in detail because I was busy reading everything else, but there was a mention of Fragile X syndrome in fetal alcohol syndrome documentation. Similar, yeah. And I didn't look to see because I was like, well, who's going to call me on that one? No, I'm just kidding. I'm kidding. It's fine. So this is to give you a picture. The brain on the right is a 6-week-old baby who is exposed to alcohol throughout the pregnancy. So you can see it's totally different. Yeah.
So when you're talking about exposure,
Mm-hmm.
you're talking about sustained over.
It depends. It depends on duration. It depends on amount. A parent could drink, a thing of whiskey every day, and I find it hard to believe that the child would be fine, but it's possible. And then a parent could drink, a thing of whiskey once a week, and the child could have severe fetal alcohol syndrome.
So what do they find these symptoms for, like, you might not know you're pregnant for a month
Yeah.
or so. Does it show up for people who?
It can. It can. I mean, again, the advice is if you think you might be pregnant, just don't drink at all. But it's really hard to tell. I know people often want to know, like, well, how much or how long, and it varies depending on the child. Also, the more pregnancy a mother has and she drinks throughout those pregnancies, the more severe the symptoms are. So baby 1 might not have really any symptoms, and baby 5 has severe symptoms with fetal alcohol syndrome. And also, very interestingly, if you have twins and they're fraternal twins, the effects can be totally different. I worked with a set of fraternal twins. Mom drank throughout the whole pregnancy. The boy had a lot of issues and pretty severe fetal alcohol syndrome. The girl, totally on target developmentally, totally fine, no physical symptoms, nothing. Whereas identical twins, because they share the same sac, they're going to have the same effects.
Sarah, did you find anything about the connection between prenatal care and fetal alcohol?
I didn't. Do you mean in terms of like encouraging a mom to abstain?
Because there has been some literature that suggests that it's the lack of prenatal care that can contribute to some of these symptoms because the prospective mother is not under the care of anyone, so that isn't getting contact with anyone in terms of asking questions about
The impact of it.
abuse or other kinds of things.
Yeah.
So that there was, for a while, there was some mixed bag about, is it really fetal alcohol or is it really the effect of poverty and the lack of prenatal care? And
Right.
So.
But I think we would see more kids then with those same features because there are a lot of parents that doesn't get that prenatal care,
Right.
Yep.
that doesn't drink, and
Right.
so on.
Yeah.
And so, if that was the case, I would think that
Yeah.
we would see more kids
Yeah.
with
Yes.
these kind of
I'm
situations.
I'm just curious about it, because we also know things like folic
Right.
acid is really an essential nutrient,
Yeah.
or micronutrient for pregnant women, and that the lack of it, and choline is the other one, that children in a very, in a cognitively different way.
Right.
Because of that, it doesn't really have anything to do with exposure to drug use, but it's other kinds of things. So
Right.
I'm just raising it as a.
I mean, from an education perspective,
Yeah.
I think it would be, that could
Yeah.
play a role. You know, if you're not going to a doctor while you're pregnant
Right.
and you don't necessarily know that alcohol is going to harm your baby,
Or
then,
you hear that people in Europe drink all
Yeah,
the time.
exactly.
Or my grandmother, you
And
know.
I
Mm-hmm.
also feel like there's been a shift in, like, I remember when I was in maybe middle school, there was this whole period of time where they had like tons of, not propaganda, like advertising, like all these like national campaigns trying to spread awareness, and that has, like, I feel like
yeah,
dropped off
Mhm.
completely, and that
Mhm.
makes sense
Yeah.
to me because, like, I mean, I feel
maybe the message was out. I mean, I don't know if they were like mandated to do that.
Well, no, I have to
They
say
have that
this.
little tag at the bottom of commercials where they say, if you're pregnant, don't drink. So,
True. I'm just raising.
yeah.
it as a-
But also, you know, things like poverty, living in a really violent neighborhood, that's going to impact a mother while she's pregnant. Her stress level is going to be higher, and that's going to affect the baby. So,
Right.
but my understanding is those kind of features are from
Right.
the alcohol exposure. They're not from, you know, the mom not getting prenatal care. That's just the research that I've found.
And the other thing I just want to say, in the
Mm-hmm.
plug for health screenings and for taking care of infants, that we know that effects of elevated levels of lead in young children
Mm-hmm. Yep.
absolutely leads to mental retardation
Right.
for a really short period of time.
Yes.
There is research that's happening now, and they are long-term studies that are very, very clear that extended exposure to lead leads to things like poor performance
Yes.
in school, difficulty with self-regulating behaviors, so that when they do questionnaires about people in jail, if they had exposure to lead, that there is somewhat of a correlation. So I think we need to that's something I think that we need to really remember with about asking those kinds of questions.
Right.
For those environmental
Right.
things. Mercury is another one that's a little shifty, but the
Yeah.
lead is like really a big
Right.
deal. And it does lead to behavioral
Yeah.
problems really early on. So you can have a 3-month-old who has, or probably a 6-month-old who's starting to throw around, who might be nibbling
Yep.
at things, and that effect of lead is going to happen right away.
Right.
And the child is going to look like there is some other kinds of delays, and it could look like that it's
Right.
socio-emotional, but it's really, it really is a physical thing.
Yeah.
And as soon as you take the lead out of it and the level starts to drop, the behaviors can go away.
Right. And that's always the difficulty. You don't know what's environment and what's other issues that are going on.
You know, it's just a
So,
plug. It's just a
right.
plug.
Right. And, you know, with the fetal alcohol syndrome, typically you see the physical features, whereas the lead would cause the behavioral stuff. And I'm sure if you did a brain scan, you'd see all sorts of brain issues. And it's also important to know kids with fetal alcohol syndrome don't always have the physical symptoms. So a lot of it is self-report by the mom. So where in your brain? Your left side and your right side. Most people have probably heard about left side, whether you're a left side brainer or you're a right side brainer. I ran across a really interesting thing on the internet last night. It was this image of this woman spinning like this, and she was spinning in a circle. And it said, "Do you see this person spinning to the left, or clockwise, or counterclockwise?" And my dad and I looked at it, and we both saw her spinning clockwise. And my mom looked at it and said, "No, she's spinning counterclockwise." And it's whatever side of your brain is dominant that allowed you to see this. And we got into this huge thing. My mom's like, "Don't you see it? She's going counterclockwise." And I was like, "No, she's spinning this way." So the left side of the brain does positive emotions, language, approach to new situations, ideal logic, critical thinking. The right side is sort of the more hippie side, you know, the creative side, expressing emotions, intuition. And just by the way, I'm a right side brainer. So the right hemisphere has a growth spurt in the first year and a half and is dominant for the first 3 years. So this is why you see kids saying no a lot or getting really angry. Lots of expression of negative emotions because they're really working on their right side of their brain. Early attachment experiences may impact the development of the right brain because it's that 0 to 3-year-old phase. And interestingly enough, I need to stop saying that, but there have been some studies on prisoners and the difference in the right side of the brain, left side of the brain, and those that experienced adversity in the 0 to 3 tend to have their right side of their brain impacted more. So healthy right brain activity supports mental health throughout the lifespan. You see kids that are in foster care who have experienced abuse and neglect, and then they come in and people are like, oh, well, those foster kids, they've all got all these mental health issues. Well, if you're not fostering and supporting the right side brain development, then of course it's going to make sense that this kid is going to be more distressed when they become older because you're developing the side of the brain that deals primarily with emotions. If you're not developing it, it's underdeveloped and you're going to have issues. So we're going to pause for a second and take, not for a break, but do a little activity. So you folks are going to, let's see, we're on the left. If you guys could come up with a couple activities that would strengthen the right brain. And if you guys can come up with a couple of activities for kids, these are for teachers to help with kids, for the left brain. And then I'll talk a little bit about activities that encourage cross brain development. Just like 3 minutes or 5 minutes, whatever you guys want, 10 minutes. If you guys want to be here all afternoon, we could totally do that. Or if you guys would prefer, I can write them up here and you can just shout out things. You guys want to do it as a group? Okay. Okay, I think I'm just going to write down a few of people's ideas. Right brainers? Anybody?
We had said reading a story and asking the child to talk about the feelings of the people in the story, or the of the story and character maybe. And then also expand that by having the child creatively, maybe give endings. Right.
Very nice. Create. So some of the things, anything else? Dramatic play, yep, that's one of the ones that I had too. Sort of anything to encourage the sort of creative side. Singing, playing instruments. Play-Doh. Imaginary play. Dress up. Okay, and the lefters? Okay. Okay. I'll do my best. Yes.
Positive relationships.
Okay.
Exposure to new situations and rich environments.
Mm-hmm.
Problem solving through blocks, puzzles,
Mhm.
serial work, and beating.
Nice.
Reading.
For language, yep.
Singing, rhyming, using humor with silly rhymes and silly facial expressions. Finger plays, a mystery bag.
Finger plays. What's finger plays?
Oh,
like, oh, the itsy bitsy. Yeah. Sorry, you can tell I'm not a preschool teacher. Okay. Okay. Yeah, that's really great. And these are all great suggestions when you guys do the training or components of the training for your teaching staff to have them brainstorm about this, because chances are they're already doing a lot of this. It's just knowing what they're actually doing when they're having the kids do these activities. And for cross, yes, exactly. And for cross activities, a couple, the ones that I mostly came up with were for older kids, having them crawl while chasing each other, because anything that's both sides of the body or cross lateral stretches like that, because then you're crossing over, and just keeping in mind that the left side of the brain controls the right side of the body and the right side of the brain controls the left side of the body. Just a little random factoid.
Have you heard about a brain gym?
Yes. Uh-huh.
Is
Yeah.
that because of that? Yes.
Yeah, I would guess so.
Crossing that one. Because
Yeah.
they're saying, like,
So
the
crossing.
child is having, you know, like spinning around.
Yep.
This teacher can start with cross and then
Yes.
and the child seems to calm down. But I haven't seen any classrooms.
I haven't seen classrooms do it, but that's a great thing to bring to the teacher's attention. I've also seen or heard teachers putting tape down the middle of the kids so they understand what their midline is and what the crossing of their midline is. Because, you know, it's hard for a kid that's like spinning like a top and then being like, cross yourself. But if you're like,
We
look at
use
the
it a
tape.
lot with the toddlers where we just
Yes.
take them from, we move from one room to another and then all have to call.
Yes.
We just call and they all call from their room to the motor room and so on.
Perfect. Exactly.
IMIL has some of that.
They do
Also,
that.
too. So for a child who is ambidextrous, are there left and right
Oh.
side brain compromises?
I don't know, actually. That's a very interesting question. Do you want to put it on the parking lot and I'll look it up? I can get back to you on that one next week. I would assume that ambidextrous is drawing on both sides of the brain for certain activities. Yeah,
I wonder whether there are deficits as a result of that.
could be. It could be. I would think, yeah. 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 Okay.
That's my question.
Yeah, I would guess so because I would think they're getting more practice with the crossover brain, so they're using both sides of their brain instead of being a sort of a traditional left brainer or right brainer. They're getting more cross.
This way that worker would be going.
Huh?
Like why, like what's the, there's no way to indicate like why someone would be right side, right dominant versus left.
I think a lot of it is temperament, some of it's environment, experiences. I've read a couple interesting studies on twins, identical twins who were separated at birth, and that they actually tend to either, if let's say they're right brainers, if they're separated and raised in separate homes, they tend to both be from the same side of the brain, but if they're in the same home, they often will be in the opposite side. So I'm going to start moving a little faster because I can just talk forever about this stuff. So who wants to guess what's the difference about these two brain scans? Anybody? They're both for 3-year-olds. Uh-huh. Do you have any idea why they would be different sizes? Ding, ding, ding. That's right. When a child is neglected, their brain stays small. When they're not stimulated, they're not creating those neural pathways, their brain's not growing, and you end up with a child with a really small brain. Yep. What?
Speak to the spaces, the kind of melon or orange-shaped dark spots on the right that are bigger, they're there on the left,
Here?
not larger, are those?
This, you mean? I don't know because I'm sorry, I don't know about it. I just know the size. I'm guessing it's just more covered in the left one because you've got more brain going on there. So they're probably similar size. You can just see them better in this picture. Yep.
Something that could be reversed at this age of a 3-year-old if the environment changes.
It can be like with anything else. However, the progress is going to be a lot less at 3 than at 6 months. Yeah. So your brain is always growing, but the growth during 0 to 3 is I think your brain is fully grown, or 90% grown by the age of 3. So you've got a space of like 10% after that. So sights and smells build connections in the brain. If not, those connections die, and the brain is much smaller, it doesn't grow. So it's really important to keep kids in really stimulating environments, not too stimulating because we don't want to overstimulate them, but to engage with them so that they're constantly creating new wiring and their brain is growing. That's pretty much their job at this point. The brain should be growing. Any thoughts on what's different about these brains? Mm-hmm. Yep. Yes. So, exactly.
So the executive functioning is going to be definitely.
Ah, you guys are totally on top of this. Yes, that's exactly what it is. The brain on the left is a typical 5-year-old. The brain on the right is a Romanian orphan who was institutionalized shortly after birth. And although it says abused brain, the child was neglected. I'm sure they may have experienced some physical abuse too, but abused incorporates abuse and neglect. So this is a child who had really no stimulation, probably spent a lot of time by themselves or in a crib, and you can see the activity in the prefrontal cortex, which is right here, the executive functioning, so the one that does impulse control, emotional control, is really lacking. And I know I need to get moving, but there was there are a number of articles on sort of Romanian orphanages in the 80s, I believe, or the 90s, where all the kids were being dropped off, the infants were being dropped off the orphanages. They had all of their material needs being met. They had clean clothes, food, diapers, and they were left in their cribs because, they were meeting all of their basic needs, so they should be fine. And the kids started dying like nobody's business, and they couldn't figure out why that was, and what they found out was kids need engagement. They need touch. They need to be held. They need to be cuddled in order to grow and to thrive. So like you guys had said, this is the area that's impacted. And over there, it just gives you, I couldn't find an aerial picture, sorry. Gives you an idea of where the different aspects of the brain are. So you got the emotional regulation right here. And this goes back to what I was talking about before about the brain scans of prisoners. They did brain scans of a bunch of violent criminals that were in prison and serial killers. Serial killers totally had normal brain scans. People that were there for violent crimes, their prefrontal cortexes were seriously diminished. And so that would seem to indicate that, they are lacking that impulse control and the executive functioning to control their actions. Not to excuse it, because as this article said, they need to be in a contained setting like prison. In that case,
You said serial killers, the executive functioning was
normal.
normal.
Yeah.
Well,
Yeah.
well, actually, if you think about it, they have to go through a whole series of stuff.
Oh, yeah.
Yes. Exactly. Yep.
Planning aspect of brain connections.
Yeah. They need that whole brain function.
It's really more, it's really more.
Oh, and just to go back to the different brain sizes too for a second, nutrition is also a really big component of it. I'm just going to touch on that briefly. And sleep. Kids need a lot of sleep, and they need good nutrition. If they don't, then their brain doesn't grow. Because if they don't have nutrition, 60% of nutrition in the first year is used by the brain, and then it's reduced to 30% by age 3. But if you also think about it, if a kid's not getting enough calories during the day, they're going to be far less engaging because they don't have the energy. There was a little baby girl that I knew who just had zero, she didn't cue for eating, she was never seeming to be hungry, and she basically laid around. She was only 18 months, and she basically laid around, was really delayed with her motor skills, fine motor skills. And it wasn't that the relatives who she was placed with weren't trying to encourage her to eat. She just had zero interest for whatever reason. But then they worked with a therapist, they started picking up her eating and helping her with it, and she was like a totally different child. She started walking around, engaging, smiling, laughing, but she was also really tiny because of the lack of nutrition. Deprived environments had brains that resembled Alzheimer's patients. Animals that have been raised in zoos have 20 to 30% smaller brains. They don't need their executive functioning. They need it, but they aren't having to make a lot of executive decisions, and there's less stimulation in a zoo setting, no matter how good that zoo setting is, versus in the wild. So behaviors from a traumatized brain. Childhood trauma, repeated abuse, witnessing domestic violence, etc. Children continue to show physical symptoms of fear even in the absence of threatening stimuli. So you get a kid who just won't lay down for nap time. They're hypervigilant. They're constantly watching. That is likely because, it could be a whole bunch of different things, but one possibility is something that's going on at the home where the child is in hyper alert all of the time. So the physiological changes: high resting heart rates, high levels of stress hormones, right brain activity increases, blood pressure, wiring in the brain changes in brain activity. The left brain slows down, and increased muscle tone because they're tensing all the time. And it's really hard for kids to, because this is physiological, it's really hard for kids to just like snap out of it. They often are stuck in the trauma and can't get out of these physiological responses themselves. But the number one indicator of being able to move through a trauma and past it is a supportive and engaging caregiver. Yep.
Well, I'm wondering, since there is this now that says resting heart rates, and, families, children who are taken to the hospital over and over again with injuries that are questionable, are these things now that physicians are looking at and saying, this is the third time the child's been in the hospital with a major injury in the last year. Let's look at your brain scan, or that, are they starting?
I would hope so, but I would guess not, because nobody wants to pay for it. I mean,
If they're going to the emergency room,
yep,
they don't have time for that, so
Yep.
they do what needs to be done, and then it
yeah.
falls into
And it doesn't necessarily fall under sort of medical necessity. That's what in cases that I've dealt with where kids have repeatedly had to go to the hospital for injuries, suspicious injuries, when we've asked them to do a brain scan on the child or something, they're like, sorry, it's not a medical necessity, insurance won't cover it, we're not going to be able to do it. Yeah, exactly.
But that's where assessment and screening and
Yes.
advocacy comes in.
Exactly.
That's why if we advocate and keep it up and keep the documentation going, then after a while, you get what you want.
Right. And, this is all physiological stuff, but you're right. In documentation, you can presume that this is probably what is going on inside the child. Somebody else? Yeah.
But it does seem like it would make sense to do a resting heart.
Well, and they may.
I mean,
They may.
Initially, when they came in the ER, when they were, crazy wild, because they do when you initially go in. But then, after they've been sitting there waiting for 2
Right.
hours to see the doctor, is it still?
But the question is that really indicative of what their resting heart rate is, or is it because they're stressed because they're in the ER or their parents are mad? I think they're less likely to draw conclusions from it just because they're not. It's like with the drug studies, what is really causing the behavior or what's causing it? And little kids can't talk and say, wow, my heart is pounding all of the time. But the older ones can. So again, the relationship with the primary caregiver is really important to help a child move through trauma. Even if the caregiver can't prevent the trauma, so let's say it's a domestic violence incident and the caregiver can't prevent that, being there for the child and helping the child, understanding where the child is, will help them move through that and be able to get past the trauma. So behavioral changes. This is often stuff that you would see in a preschool setting or an elementary school setting. This is what sets off the flags of all the mandated reporters and people that are engaging with the child. And this is stuff for little ones that it's really important to pay attention to, because this is all sort of the really subtle stuff that with an infant you may miss or the teacher may miss, but it's important to know, increased startle response to loud sounds. That in and of itself may not be indicative of the child being exposed to abuse or trauma, but it's one component. And then looking at sort of this whole list and thinking, what of these, what if it's a little checklist, what is this kid experiencing? And then,
That's a bit, the tuning out all non-critical information.
Yeah.
I feel like I've gotten a couple of teachers that have said to me, this child is like just not listening,
Yep.
not listening, unless I'm asking them to come eat lunch. They
Yep.
just-
Yeah.
I didn't even think of that.
Yeah. And sometimes, it can be something else like ADHD. And sometimes it can be because the child's in hyper alert all the time. And so instead of their brain being able to build the neural pathways around, wow, let's work on my coloring and my coordination with that, they're in hyper alert and they are worried all the time about their basic survival. So there's no way that they can take any energy away from that to focus on other non-critical issues that are happening in the classroom. So we were going to do a small group activity on this one, but we've totally run out of time because I talk too much. But it might be a good thing for teachers to think about, you see a child with some of these behaviors, what do they think is going on at home for this child? What is this child experiencing that may result in this? Yeah.
I'm so glad you're doing this, because I've heard of so many kids on sleep medication.
Yeah.
or kids
Yep.
being diagnosed with ADHD right and
Yep.
left, and how do we know?
Exactly. And, I think people are so, you bring a child to a pediatrician, and I've repeatedly heard from pediatricians, they're like, that's not my job to diagnose. They don't say it in that tone. They say, I'm concerned with the medical issues that are going on with this child. I don't have the time to look at what's going on with them at home. Have they experienced any trauma? Is that why they're not sleeping? Is that why they have explosive bowel movements all the time? And so they put them on medication because that's what the parent wants, and the parent is not going to be disclosing, yes, my house is very violent and that's why this child is in hyper alert. And so they put them on medication. The kid gets a diagnosis of ADHD or autism or whatever they have diagnosed him with, and that sticks with the kid forever, versus dealing with the underlying issue. Does this kid really have ADHD, or does this kid have trauma history that is presenting in that way because they're being hyper vigilant? But it's easier to medicate kids. You have a 2-year-old who's not sleeping and is wandering the halls, knock them out with medication. And that's so much easier for the parent or the foster parent, but it's ultimately not better for the kid, which you all know anyway.
It's also an easier sell for the doctor.
Yes, exactly.
Honestly, convincing the parent that's coming in that has whatever they have going on at home,
Mm-hmm.
and the doctor's got 15 minutes.
Yep.
And convincing them, well, let's look
Yeah.
at what's happening environmentally or
Mhm.
health-wise.
Yep.
Let me send you to somebody.
Right.
But it should set up a flag in the
It should.
head,
Yeah.
What is this?
Yeah.
Follow up with it. Why are you giving medication?
Right, right. Because they've got a parent who's saying, my kid's not sleeping, I'm not sleeping, I'm in a really bad mood, can you give them something? And I've seen it time and time again. And because, the person who, if they're not a supportive, engaging caregiver, or if they're just really, really tired, they want the kid to sleep. And it's much easier to medicate the kid rather than changing the environment that the child is being exposed to, and taking the personal responsibility around having this child exposed to this situation. Okay, so now we're really, cortisol. We're gonna move really fast through this. I find cortisol very, very interesting, but because I've talked too much, we're gonna have to really crack through this. So cortisol is a hormone that's released to the brain in response to stress. Although, interestingly enough, we all get a burst of cortisol first thing in the morning, helps us get going. Because otherwise it would be really hard to roll out of bed and do your day. And then you get really low levels throughout the day and it tapers off so that you can go back to sleep at night. For newborns, interestingly enough, they do not get it in the morning. They get it every 12 hours until they're about 3 months, which is oftentimes why you see a change in sleep patterns for little ones around 3 months. And then they start getting it in the morning when they've figured out the night-day thing. Of course, too much of anything is a bad thing. If you have cortisol, if you're a child who's been exposed to trauma or violence, abuse, neglect, your body is releasing this cortisol all the time because you never know when you're going to need to be prepared for a stressful situation or a dangerous situation, because it gives you this quick burst of energy, heightens your memory, and it's supposed to say decreases your sensitivity to pain. So, for let's say an average child who's not been exposed to violence, you get the burst in the morning, and then it's just kind of woo, 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 like that throughout the rest of the day. For a kid who's been exposed to trauma or abuse or neglect, they get the burst in the morning, and then, oh my God, somebody's coming in the door, I've got another alarm. Oh my God, somebody's coming at me, with another alarm. So they've got these bursts, these big bursts throughout the day, and they're in hyper arousal all the time. And so it goes back to what we were talking about before, that then they're not able to concentrate on sort of the non-critical information that's going on because they're in high alert all the time. They're in crisis all the time. So just very briefly, I'm going to talk about the different types of stress. Allison and I are going to talk about this more next week in more detail. But all stress is not bad stress. There's toxic stress, which is bad stress. That's where you see a lot of these behaviors coming out in the kids. You see the cortisol being released all the time in the kids. This is when you get strong, frequent, or prolonged adversity, such as physical, emotional abuse, chronic neglect, creates a stress response in the body that disrupts brain architecture growth. And your other organs. Oftentimes you see a suppression of the immune system because your body is just focusing on the basic survivals and the immune system. If you're going to die tomorrow, who cares about your immune system? So you just got to focus on the basics. Tolerable stress is when your body is, you still get the release of the stress hormone, but it's not prolonged incidence of stress. So like you lose a loved one dies, you get into a horrible car accident, you have some kind of horrible injury, but you're going to get through it, and it's probably not going to happen again, at least for some time. And that's when, that can be buffered really well by a receptive caregiver. They can help you through that. But the brain and the organs recover from that. So you have this stressful period, and then it slowly tapers off, and with a receptive and responsive caregiver, you can move out onto the other side and continue on with your healthy, productive life. And then positive stress is just normal, healthy stress. Everybody has it. If you get a brief increase in your heart rate, yeah.
We talk to parents a lot at the beginning of like preschool when children first start about
Yes.
positive stress.
Yep.
They're having a great morning, they're holding it together.
Yeah.
They're engaged and everything, and then they see the parent and they took it
Yes.
apart and start crying. And the parent's like, oh my gosh, they must have been traumatized.
Mhm.
Whatever. No, it's just a level of positive stress.
Exactly.
Especially if you experience it.
Mhm.
And then it can create this rebound.
Exactly. Yeah, exactly. The first day of preschool, stressful, but you get through it. You come out on the other side, and 2 weeks into it, you're like, Psh, this is fine. There's my teacher, there are my friends, there are my toys.
Or sometimes it can be delayed.
Yep.
2 weeks after the start.
Yeah, exactly. Okay. I'm just seeing if there's anything else. So there's a lot more about cortisol, which I'm not going to be able to get into, unfortunately, because I love cortisol. But it can have really devastating effects in the body and the brain development, particularly for a 0 to 3-year-old. It affects, and all of this stuff, you may not necessarily be able to see it, but when this kid is 3 or 4, you're definitely going to start seeing it, where they're not able to control their impulses, they're not able to control their behavior. So this is a really critical time when you really want to try to work with the child to create positive experiences and keep the toxic stress low so that you can keep the cortisol levels low. And just as a very quick side note with preschoolers, kids with increased cortisol levels, which, by the way, you can test, it's a simple saliva test to see what the cortisol levels are. But one more thing that I don't guess that ERs are doing, or doctors. But when you get increased cortisol levels, it's associated with poor effort control, self-regulation skills are decreased, it's shorter attention spans, memory. But again, all of this can be mitigated, at least to a certain degree, by a supportive, engaging caregiver.
Does that have to be a parent?
Nope.
Or it could be-
When I say caregiver, I mean anybody who has a consistent role in the child's life. So it could be a teacher, it could be a parent, it could be a grandparent, it could be a neighbor, a good friend, anybody who is seen as a support figure for that child or a secure base in a stressful situation. Like you walk into a room with a 2-year-old where they don't know anybody or there's something scary. Do they freeze and turn in on themselves? Do they turn to you? Who do they turn to? And that person can help them through it.
So even if the child needs to be exposed at home to
Mhm.
a stressful situation, by being in a supportive environment every day, it really does show that
Yeah.
their cortisol levels begin to decrease.
They may not decrease, but they're not going to increase. So oftentimes I'll be called in to consult on a case because a kid is like off the wall in a preschool setting. And so I start working with them and, 6 months down the road, the teachers or the parents or whoever it is, they're like, well, the kid's behavior, it's not changing. And I'm like, but it's not getting worse. If you're only working in a preschool setting and you're not addressing the home environment too, you're not going to see improvement. You're not going to see a decreased level of cortisol because the child is still being exposed to those devastating experiences somewhere else. But, what I look for is sort of, are they maintaining the baseline? And ideally, yes, you would want to see a decrease in the cortisol levels, decrease in the behaviors that are indicating this child is being repeatedly traumatized. But you can't just do that in preschool. But it's still half the battle, so.
Did you say it should maybe, in the top paragraph, burst of energy and heightened memory and decreases?
Yes, decreased sensitivity to pain.
Heightened memory.
Yes, heightens memory. So like if you are in a car accident and people tend to remember a lot of details because their adrenaline is pumping, and you're sort of, for the moment, you kind of go into shock a little bit and you don't feel any of your injuries. And then an hour later, you're like, wow, I broke my arm. So these are just some things that I came up with on how to ensure good brain growth for teachers. And, this is stuff that teachers can do on a regular basis. When you're doing the training with teachers, this is a really great thing for them to brainstorm on and see if they can come up with any suggestions themselves. Because again, a lot of this they're probably already doing. They don't necessarily know how it's impacting the brain development, though. Okay, so now we're going to take 15 minutes, but now we're going to take 10 minutes. And if you could break into groups of 3 and sort of think about these 2 questions, and then we'll come back together and see what people come up with. Okay, everyone. So does anybody want to talk about what their group discussed in terms of what concepts about brain development did you find most helpful today and would find helpful to share with your staff and or parents or caregivers, and how you want to, well, we can deal with the how you want to deal with it in a second. Anybody? Nobody found anything useful today? Okay.
That connecting it all, like connecting that there's a huge amount of development in a relatively short amount of time, and how behaviors are linked to what goes on.
Yeah. And did you guys feel like you would be able to explain it in simple terms enough that somebody that has no experience in this could understand it and apply it to their work or their engagement with kids? Yeah.
I think that the behaviors of traumatized brains are supposed to have and talk about it, since we serve so many children that comes from families that are struggling,
Yeah.
families that are referred to as PCF, that we know that comes in with a lot of trauma. And it's easy because, for parents to label their child as having ADD, or even the teachers kind of fall into that same other signs that, brain.
Right.
Trauma.
Right.
Brain. And obviously, you know, there is a lot that is
Yeah.
happening. So understanding that doesn't mean that we are necessarily labeling or telling, oh, this is what it is, or identifying kids, but it gives us a better understanding that there's more than just a medical term
Right.
that we can use and say, oh, this child like
Right.
this because it's doing all this stuff, but that there's other parts,
Mhm.
in other kind of, situations that are happening in this child's life, it can be contribute to this behavior and not necessarily anything that has to do
Right.
with a disability.
Yeah, and I find it really interesting that people don't always consider trauma when they see behaviors from kids. They don't think about brain development and how the trauma may have affected it, because trauma is a really ambiguous term. You know, you don't know exactly what the kid experienced, whereas ADHD,
Yes.
really defined. You know, there's a whole book of books about ADHD, and it's medication and we're done. So whereas trauma is much harder, and it's also painful for people to look at. Like, what is this kid, this baby experience that has led to all these behaviors that now I'm having to deal with because of what they've experienced somewhere else?
Well, I also think though that the word violence conjures up certain things.
Mm-hmm.
But the word trauma says, has a very different emotional trigger.
Mm-hmm. Yes.
And when you talk about trauma, implied in that is that something bad happened.
Mm-hmm.
And, you know, and I think that that is much more encapsulated than the term neglect or violence or, I mean, we know what those are, but
Right.
trauma is just much more.
It's a wider umbrella that encompasses neglect and abuse. Yes, exactly.
If you say you're traumatized by something, people get it, that something really
Right.
bad happened.
Right.
You know? But if you just say, you know, that somebody, you know, like hit me or something, it's a different, there's a different social context to that.
Right.
You know, so I
Right.
think that it really is like helping people
Mm-hmm.
saying the words and labeling it, and,
Yep.
you know, and helping people understand like what, that it doesn't mean that that you did something bad because something bad happened to you. You know, I mean, I think that there really is a sense of, as much as you can, like normalizing terminology.
Mm-hmm. Yeah.
You know, I mean, you know what I mean. It's like, you know,
Yeah.
normalizing that.
It doesn't feel like you're blaming.
Right.
If you're talking to a parent and you're saying, and you may know
Yes.
what's going on in the home, and you say, your child's reacting to the violence in the home,
Yeah.
versus
Right.
your child is experiencing trauma.
Right.
And
And I think that's a really great way to explain it to parents. It makes it less personal for them and makes them more willing to engage around services, because you're right, nobody wants to know, nobody wants to hear you got violence in your home and it's got negative effects on your kid, which we're seeing here, because that's all about the blame. Whereas, and also likely the parent is being traumatized by whatever is happening in the home.
The thing is that we know that there were really, really, really good reasons why parents do not disclose what's going on in the home. We know that it means, of course, it was a whole secret thing, but also is that whole thing that it puts people at risk when they say stuff out loud.
Right.
We know that there are other people that in their shit that people said to them, you tell anybody about this, and I'm gonna kill you, and we know that that happens.
Right.
So we have to be really respectful of the fact that the reason why people don't say, it's not that necessarily that people don't want to share, it's that they might be really afraid for their lives. And
Right.
we have to really remember that.
Well, and unfortunately, we are mandated reporter, and
Yep.
the first thing we tell that parent is that we are. And so, when they come,
Right.
they're not gonna tell you if their child has been abused by somebody in the home, or if there's
Right.
a fight, because they know that immediately you're going to have to report.
Right.
And then that's gonna have consequences the whole life, and on this other person, the perpetrator, and everybody else.
Right.
So, it's a big thing, and
Yeah.
yes, it's a big secret, and that's why it's so hard to get help with these little ones,
Yes.
because parent will not admit that something is going wrong, just because it's
Right.
it's opening this big can to
Right.
everybody else get into your space.
And something also that in response to that, also what I've found is helpful with parents is talking to their kid about being in crisis. Like sometimes, like I want to help you and help your child because we're seeing behaviors that indicates there are moments where your child is in crisis. And it doesn't necessarily matter what's caused that. I mean, we can theorize, but you're right. It's secret. We're mandated reporters, and the parent may not want to disclose that. But most parents, every parent that I've ever worked with, wants what's best for their kid, and they don't want their kid to be in crisis. They don't want them to be distressed. They want to know how to help them, even if they can't fix what is necessarily going on at home. And it's what we went back to in the training around having a responsive caregiver who may not be able to prevent the trauma, but can help the child, or the action that's causing the trauma, can help the child move through the trauma. And that's, I think, a big role for all of us that work with parents and caregivers.
Some natural effect of like, maybe like once you have eyes on something and someone's, even if it's involved with the child only, that has ripple effects. And it's
Yeah.
going to hopefully be able to make the help of that family.
Yeah,
But the other side to that is that that's sometimes that's what it seems that we do.
yeah,
Just try to pull their child through that trauma.
Yep.
And that's a lot in a classroom that
Yes.
you have 17 little ones going through.
Yeah.
And 5 of them have these trauma constantly.
Yep.
And every day you're trying to go back to that same place again and try to move
Yep.
forward. It's straining for staff.
Oh, it's
straining
hugely
for the rest of
straining.
the kids.
Yes.
I see in the years that even the rest of the kids feels like they are so overwhelmed. If they're experiencing trauma just by being in the classroom
Yeah.
with these amount of kids.
Yep.
And so as much as we want to do, if that parent is not willing to
Yes.
engage, we
You
have
can't
to
do it
figure
all
out a way of
yourself.
Something that we have to do to
Yeah.
protect all the other little ones that are in there
Exactly.
as well, experiencing now the trauma in our environment.
And that's something we're going to talk actually about in session 4 about vicarious trauma, sort of you holding all that trauma for that kid and experiencing the after effects with them and the impact as a
And
caregiver.
You go home and you drink.
Yeah, exactly.
End of your day,
Yep.
You feel like you have been beaten and everything, and you
Yep.
go home and you don't want to hear anybody else. It's
Yeah,
like,
exactly.
what do I do?
Exactly. And that is something I think that's traditionally kind of been neglected in this field around talking about what's the impact on you, learning about hearing about this trauma, and you know,
Social workers get burnt out.
Yes.
Do it for 10
Yep.
years and they're like, I can't do this for my career.
exactly,
Well, who do you talk to? I mean, it's like,
right.
can you go home and talk to people at home about like the really ick-hole things that happen? How, we have our families that we want to protect too.
Yep.
And so, I mean, how much do you really want to say that
Right.
to other people?
Right. And if it's not coming out, where's it going? It's going inside and then just eating you from the inside out. So, but we'll talk about that. We are totally out of time. So I wish we had gotten to more. I know you guys spent a lot of time on these questions. But if people want to fill out the surveys, and also just quickly, there are some handouts that should have come in your packets today. Just Healthy Minds, it's 0 to 3, breaking it out for different age groups. The impact of prenatal drug exposure, because a lot of teachers asked me for this, so it just sort of some of the signs and symptoms.
That's
And
that's a very important for us as parents.
yes, yeah,
I had a mom that was on depression medication, this is Suboxone, she's pregnant,
Yeah.
she's smoking,
Yeah.
all these things. And then when she and I had a relationship, and we said, really smoking's not so good. She's like, I already know this issue. And I said, you talk to the doctor, and she's like, yeah, but the Lord both ways.
Yep.
She's very, minimizing the whole effects.
Yep.
And I was thinking, and I told her that maybe I'll go back and give you more to read, and then you can make the judgment.
Yeah.
So if I have something like this, I'll be like,
yeah, exactly. And I didn't even talk about prescription drugs on there too. That's like a whole other effect too, and abusing those. So, and then there's one more handout that says some interesting questions you could consider with your staff, and there's a web page link that has this really cool 3D image of a brain, and if you click on certain age groups, it tells you what areas are being developed at what time. So thank you, everybody.